Knock, knock, knock. Can I come in?
Come in.
Okay. I'm going to go ahead and perform a hand hygiene. And then I'm going to go ahead and close the door for privacy and the curtain for privacy as well. Hello, my name's Charissa. I will be your nurse today. The doctor ordered a head, mouth, nose, eyes, ears, and throat assessment. It should take about 15 minutes. Is that okay if I get started?
Okay.
All right. Just a clarification, a few questions here. Can you tell me your first, last name, and birthday?
Maria Asuncion Maranan, August 15, 1954.
Okay, I'm just going to check your name band for accuracy. Very good. You are who you state you are. I'm going to go ahead and ask you a few questions. Are you allergic to anything?
No.
Okay, just to clarify, latex, environmental, medications, food allergies, no allergies
No
to
allergies.
those? No allergies. Okay, and how about pain? Are you in any pain?
No.
Just to clarify, 0 out of 10, 0 being no pain and 10 being the most pain, what would you rate your pain?
0.
Perfect. I'm going to go ahead and start with your head. I'm going to take a look to make sure there's no lesions and infestations. Okay, and then is it okay if I palpate your head?
Okay.
Okay, I'm going to go ahead and palpate your head here. I still don't see any lesions and infestations. Very good. Just going to take a look at your facial features. Can you smile and frown for me? Okay, puff out your cheeks. Go ahead and raise your eyebrows. All right, looks like your facial structures are symmetrical bilaterally, so that's a good sign. Also, I want to go ahead and take a look at your neck there and looking at the trachea. It is midline and it is symmetrical, and I don't see any masses. I'm going to check for your cranial nerve 11, which is your spinal accessory. Do you mind just moving your head left and right here? Good, and up and down. So flexion down to your chin, extension up in the ceiling. Very good. And then I'm going to go ahead and have you shrug your shoulders as I meet resistance. Very good. Cranial nerve 11, your spinal accessory is intact. I'm going to take a look at your eyes next. Do you mind if you take off your glasses? Patient does wear glasses. Taking a look if there's any discharge, any redness, any lesions, and I don't see any. Your sclera is china white, and do you mind just pulling both your eyelids down for me? Very good, and it is pink and moist, so you can go ahead and lift it. Very good. I'm going to have you check your pupils next. So I'm going to have you look straight ahead right there. I'm going to shine a bright light in both your pupils here, okay? Just straight. Sorry, it's bright. Good. Good. Very good. It constricts as I shine the light. So pupils are equal, round, and react to light consensually. And then I'm going to check for your accommodation. So the next thing I'm going to do is have you take a look at the tip of the pen light here. I'm just going to move it, just with your eyes only, I'm going to move it closer to you, okay? Good. And it constricts. And as I move further, it dilates. So your eyes converge as I move closer. So that's very, very good. Okay. Next thing I'm going to do is check the patient's ears. Do you mind just kind of moving your, very good. So taking a look at the patient's ears, I don't see any lesions. I do see you do have piercings because I do see those piercing marks, but I don't see you wearing any earrings. So is that correct? Just one set of piercings? Okay, very good. And also I'm going to take a look inside here. Looking for any redness. I'm looking for any discharge or swelling, and I don't see any discharge, swelling, or redness in my patient's ears. Then I'm going to complete the whisper test. That's cranial nerve 8, acoustic, or also known as vestibulocochlear. I'm going to have you cover one ear with your hand, and I'm going to whisper a word, and you're just going to repeat it back, okay? Plants.
Plants.
Okay, I'm going to have you do the other.
Flowers.
Very good. Your cranial nerve 8, which is intact. So that's very good. The next thing I'm going to do is take a look at your nose, and I'm going to take a look, and it is midline, and it is symmetrical from what I see. And then with your nose, I don't see any lesions right now, just by looking at it. Okay. And internal structures is what I'm going to look at next. Do you mind if you just tilt your head back as I shine the light in here? I don't see any deformities. I don't see any inflammation or asymmetry or deviated septum, so that's very good. The next thing I'm going to do is check for patency. So I'm going to have you cover one nostril and breathe in and out. And then the other side. Very good. Your nares are patent bilaterally. And then I'm going to assess to make sure there's no drainage, which I don't see any drainage in the patient's nose. Next is your mouth and throat. So I'm going to take a look at that lips. It is pink and moist. So yeah, it's pink and moist. It's okay. And then I'm going to have you open your mouth for me. Stick out your tongue. Your tongue is pink and moist. Go ahead and let me take a look at your gums here. Very good. It's pink and moist. So one more time. Your buccal mucosa is pink and moist. And I do see your hard palate is white with irregular transverse rugae, but your soft palate is pink and moist. Your pharynx, I do see no redness or any drainage. Your teeth, are you wearing any dentures? Do you mind smiling? You are wearing dentures. Okay, it's well defined. Very good. Straight and well defined, so that's okay. Anything else that I can do for you today? That concludes my assessment. Just to clarify, are you having any pain?
No.
So on a pain scale of 0 to 10, what would you rate your pain?
0.
Perfect. So I'm going to document my findings, which are all normal findings. Yes, thank you. You can put your glasses back on. I'm going to hand you the call light here. If you need anything, the bed, if you were in a bed, it'd be in the lowest position. Side railings would be up. You have your call lights. Is there anything I can get for you?
No.
No? Well, thank you for letting me do the assessment. I'm going to go ahead and perform hand hygiene. Would you like the door open?
Close, please.
Close? Okay. And then let me know if you need anything, okay?
Okay.
Thank you.
You're welcome. I know.